Well, thank you, Aisha, for this introduction. Thank you very much, Illango, for joining us. I know these are very busy times, and you spared time to join our COVID policy response dialogue. I also welcome your colleagues, Dr. Alia Kashif, who is a senior health specialist, and Mr. Shabi Mohib, who is the lead economist and team lead for socioeconomic disruption response teams. Both of you welcome, and I welcome other colleagues who have joined us today. So this is webinar number 13th in a series that SDPI is convening to be able to prepare to better response to the policymakers' needs. Of course, we try through these webinars collect the wisdom from experts like you, and then do a quick policy response note for the ministries we are working with, for the ministers we are working with. So it is just to inform them, and of course we can also give you some of our feedback, what we feel is required at government's end, where perhaps you can add your value and you can have a word with them. So the format for today's talk is that we would request you to brief about World Bank's help and World Bank support that World Bank is providing to Pakistan in these testing times. We will also like to know about some of the forecasts which are floating around. We have already heard that IMF MD, she has warned of tough recession. WTO yesterday also warned of recession. And in these recessionary times, of course, one gets scared in countries like Pakistan about our economic growth forecast, what sort of fiscal policies or what sort of monetary policies we should have post-COVID, whether it would be easy for us to now continue with these IMF's extended fund facility programs commitment, or we will have to do some sort of mid-course corrections. Also, if you can highlight World Bank and ADB's joint support for this disaster management response fund, and now there is some sort of reappropriation and this permission to utilize, reallocate those funds for better COVID response. So some of these things I think we would like to get educated from you. And another point which is extremely important, and that is about how we can make all this response gender responsive. So in these testing times, we know that they affect differently women and men differently, and how we can have a better gender responsive policy response from government of Pakistan. What is it that we can recommend? And lastly, in this longish list of my initial questions, where think tanks like SDPI can help you in advocating and carrying forward your message to the decision makers, and B, through providing our on-ground research. I'm sure your team is already aware of ground realities, but wherever you like organizations like SDPI to help you in providing ongoing this our primary research that we are conducting in different periphery districts of Pakistan, we'll be more than happy to do it. So with all these queries and with all this long list of questions, I'll come to you, Illango. And once you are done, please feel free to rope in if you would like any of your team member to also join with you in those responses. Otherwise, we will open the floor and we'll collect some questions so that you can respond them. Thank you very much.
Thank you, Abid, and good morning, colleagues. It's a pleasure to join SDPI's policy dialogue to discuss the COVID-19 response in Pakistan. These are unprecedented times for the world, including Pakistan, as COVID-19 ravages the world. We have seen countries, economies, communities severely being impacted. And looks like this is going to continue for some time more. Any vaccination is still probably months or a year and a half away. And wherever social distancing has been practiced, you are seeing improvements in the number of cases coming down. Having said that, let me spend the next few minutes to talk about what the World Bank is doing globally, and then what we are doing in Pakistan specifically. So at the onset of the COVID-19 outbreak in mid-March, the World Bank announced a $14 billion global facility to support our client countries. And this was meant to provide emergency medical equipment and supplies like ventilators, personal protection equipment, and through which we have been now working with many client countries, including Pakistan. Second, more recently, as the socioeconomic disruption becomes more and more obvious and it's evident everywhere, and you can see that from contraction. You can hear that from the predictions that are given by World Bank Group, IMF, and others of a impending global recession. The World Bank has now announced a $160 billion program to fast-track investments, budget support, technical assistance, and results-based financing to enable all the World Bank client countries to be able to access the $160 billion over 15 months. 15 months starting from April 1st this year to extending till June 30 next year. So that's the global picture regarding how the World Bank is responding and assisting client countries. Let me turn to Pakistan. As of today, we have close to 5,000 positive cases countrywide. Unfortunately, 63 have lost their lives. The big challenges in Pakistan has been around the low testing, but now testing is picking up. My colleague Alia, who has joined me, will talk about that and other needs that Pakistan needs to address immediately. So what we did was, first, as soon as the government reached out to us through 8 projects, we were able to repurpose around $40 million to immediately purchase medical equipment and supplies, and some have already started arriving in the district as well as provincial hospitals, as well as support to federal government. And this was done with a lot of agility and speed, and normally what would take months, the necessary turnaround time was in hours and days. So this is quite impressive that we were able to respond along with our government colleagues at the federal and provincial level. The second is, a week ago, our board approved $200 million for pandemic responsiveness in Pakistan. This is part of the $14 billion facility that I spoke about first, which has now been made effective, and we've already started dispersing funds into assignment accounts, so the relevant beneficiary agencies can start moving towards purchasing equipment and supplies needed. This support is embedded on the 4R principles of what we have embarked in Pakistan. The first is, of course, immediate response. That's the first R. Second is the relief. Third is the recovery, and fourth is the resilience. So this $200 million covers both the immediate response and the relief. So it has 2 parts. One is around $150 million goes for financing the medical emergency part, the immediate response. Then about $50 million goes to finance the relief, which includes support to the emergency cash program that SARS and BISP launched yesterday. Another part goes to finance food rations if lockdowns continue and it's going to lead to situations of food insecurity. And third is to support the Ministry of Education and NDMA and others to undertake telelearning, which is something that the Education Ministry announced last week to support kids getting back to the learning agenda when schools are closed. So this is the relief part. When it comes to the recovery, this is something that we are currently discussing to see how we can repurpose the good part of our pipeline and make available between $600 to $1 billion to support recovery that needs to happen, primarily to address issues around safety, continuing to build on the safety nets program. Second is, we know that a lot of people are losing jobs, especially the day wage people, the poor and vulnerable. What can you do to support them through public works program, through micro enterprises? Third is looming food security issues as supply chains have broken. What can you do to ensure that there is no food insecurity or leads to situations of hunger that can also exacerbate poverty? And then on the digital economy, because I believe social distancing has given a fillip to digital economy globally. So what can Pakistan do to do more? And finally, as I mentioned, continue to build on the distance learning agenda. Now, moving on to the stronger recovery, and this is where we believe our policy-based support would become important. And at this moment, we are working with the Ministry of Finance, the Planning Commission, and the provincial P&D departments, as well as the other economic ministries like Ministry of Commerce and the Ministry of Energy and Ministry of Power, to look at the structural reforms that need to concurrently happen. And these reforms, some of them have been delayed for many years, need to happen now so that Pakistan can have a stronger and a quicker recovery. So when the world returns to some sense of normalcy with the COVID abating and subsiding, then Pakistan can break out fast and start having better economic dividends. And this is why we emphasize that structural reforms need to go hand in hand, and without that, the fiscal challenges that Pakistan has been facing will continue to remain, and it's going to get further constrained largely because of increased expenditure towards COVID-19 related response. In sum, our overall support includes, if I summarize, it supports the 4 Rs, once again: immediate response, relief, strong recovery, and sustainable resilience. That's the 4R. We made available $40 million for the immediate urgent response that was needed to buy equipment and supplies. Second, we complemented that with further $150 million to continue supporting health systems. Third, in order to support relief and some of the recovery, we provided $50 million already that has been made available. Fourth, we are looking at between $600 million to $1 billion to support the stronger recovery efforts by repurposing our pipeline and portfolio. This amount could increase as well with the coming months as we know what would be the total quantum and magnitude of the socioeconomic impacts. And finally, we'll continue to support the needed policies with the required budget support operations that will help stronger, quicker recovery and then building the resilience for the economy and the society. So Abid and colleagues, let me pause here. Let me invite my colleague Alia to talk a little bit more about our immediate medical response. As then Shabi will come in and he will talk about some of the things you asked about, the what's World Bank looking at as estimates on the socioeconomic disruption. I also have other colleagues who are joined, like Gonzalo, who can talk about the firm level surveys and export competitiveness, and Usma Quresh, who can talk about the gender issues. Over to you, Alia.
Okay, great. Thank you. Thank you. Taking forward what Illango had said earlier, we were looking into ways in how we can respond to the government of Pakistan on a ASAP basis, as urgent as possible, making sure that they get what they're required at the federal and the provincial level in terms of responding to this health emergency. So the lead agency for us was the Ministry of National Health Services Regulation and Coordination at the federal level, which was the pen holder for all demands coming in from the provinces related to health emergency preparedness and responsiveness to this COVID-19 emergency. The things that we did were that initially we mapped out the projects that were ongoing, the bank-funded projects that were ongoing, and that's what Illango talked about earlier, that amounted to about $40 million US, which were available for reappropriation to responding to this emergency. And we have our National Immunization Support Project, which is across the country and has really good fiduciary controls and has a pooled procurement mechanism, which we used to piggy ride this COVID-19 response on. And it worked wonderfully for us. We got the first procurements in with a lag time of 2 weeks. And this procurement basically focused on personal protective equipment, which was needed drastically at all levels of healthcare delivery, because people who were the healthcare providers who were providing healthcare services to the people who were coming in, the first thing that is required is personal protective equipment. And as a response, the second phase was that, we helped prepare the government $200 million US project with one large component focusing on health responsiveness, prevention, detection, and case management. And related to that project, we have already dispersed the first disbursement to the Ministry of National Health Services Regulation and Coordination, and the provinces are just ready to get their disbursements related to this particular project. So this project would basically focuses on how we can ramp up our ongoing healthcare delivery system to respond to the COVID-19 emergency. As you know that across the country, the healthcare delivery system basically is not equipped to respond to emergencies. So the idea is basically to make sure that all frontline workers have personal protective equipment available, which ranges from masks, gloves, head covers, boots, Tyvek suits, and because of the turnover of patients, every healthcare provider that comes in touch with a COVID-19 or makes contact with a COVID-19 patient, the PPE is the thing that is used on a high turnover rate. And the next thing was equipment. So the equipment kind of ranges from ventilators to pulse oximeters to oxygen concentrators to X-ray machines to lab diagnostic equipment, which is like not all laboratories in the country are BSL-3 certified. So the labs that are BSL-3 certified basically require reagents, diagnostic kits. It's a real-time polymerase chain reaction assay that needs to be done for COVID-19. So it's a very sophisticated test, and not every laboratory has the capacity of running that test. So strengthening the laboratory diagnostic network is very, very important. And the third thing is then case management. So we learned today that the Drug Regulatory Authority of Pakistan basically is going to allow for conducting clinical trials for plasma therapy for COVID-19 patients, and locally produced ventilators will also be tried out. The Drug Regulatory Authority of Pakistan has also approved local production of raw materials for chloroquine, which seems to be having a positive impact on patients diagnosed with the COVID-19. And then there is also, DRAP has also approved a local production of companies to produce hand sanitizers for 3 months. Because prior to coming into this meeting, just to give you a flavor of where we are at, the shipments, the consignments that are coming into the country, our UNICEF colleagues were telling us that for hand sanitizers, we cannot have hand sanitizers being shipped via air freight, right? Via air travel, because there's some substance in the hand sanitizers which is not safe and they don't allow it. So we get the rest of the personal protective equipment, but we don't get hand sanitizers. So there have to be ways designed for making sure that we get the remaining stuff like hand sanitizers transported into the country. The supply chains are basically choked at this point in time, even at the global, regional, and local level. You want me to carry on? Okay, so I'll stop here. This is related to health, and I'll wait. If you have any more questions, I'll come back in.
Yeah, thank you. Shabir sir, over to you.
Thank you very much, Abhisab. Thanks so much for this discussion. So let me start with your question on what's the impact of the COVID crisis on the economy. So we've been seeing essentially a gradual deceleration every time new data comes in. You see that lockdowns are being prolonged, etc. So what our latest projection is that the economy for this fiscal year, FY20, was projected initially pre-COVID to grow by about 2.4%, which was about stabilization measures kicking in, this whole sort of like external account being brought to more sustainable levels, etc. So those measures were working until February, and then the COVID crisis hit, and now we see and a severe deceleration and actually a contraction in the fourth quarter of the fiscal year, a contraction of about 11%, which essentially would take the full year growth to be a contraction of about 1.3% of GDP. So we a very sharp sort of impact for this quarter. And then for the FY21, we also are seeing how, assuming that the pandemic abates over the next 3 to 4 to 6 months, a gradual recovery. So what we see is that FY21 will see a moderate recovery of 0.8% as essentially the factors of production come back together as global demand starts picking up. So that's our projection in this regard. So the question then also is, what is it that Pakistan could do to essentially bounce back better? Illango suggested a lot of ideas that we've been thinking about. Alia also brought out the immediate responses to the COVID crisis. But then if you were to essentially say, what could the public sector do to essentially both support the immediate, but also prepare for tomorrow, I suggest the following. So the first thing is all about redeploying your resources in the current fiscal year to COVID response, right? So for example, if you got a road that's supposed to be built in the next 6 months, you can delay it a little bit because nobody will miss a road that they don't see, but everybody will miss a response that should be there. And I'm saying that because you do want to preserve your fiscal space as much as possible. Pakistan's deficit last year was 8.9%. With the COVID crisis, we are projecting a deficit of about 9.4, 9.5, or a little bit around that area. So a lot of financing will be needed, and get financing from institutions that can provide you more longer term financing. So that's important. We also are saying that, look, on the problems that the country had before the crisis remain the problems today and tomorrow to private investment. And Pakistan's biggest issue we see is a private investment rate of only half of that of South Asia. So Pakistan's private investment is around 10% of GDP, while South Asia was around 20, 25. And especially when they were growing faster, and then when East Asia was growing, investment rates, private sector were north of 30%. So then the question is, what can the country do? And here we essentially suggest one is on the whole taxation part. The general sales tax is a big issue, and they're happy to come to it if you so want to on the specifics. So we think harmonize the GST across the country will not only give you fiscal space, but it will also reduce compliance cost for businesses. The second thing that businesses keep talking about is the regulatory morass. So essentially, we think that this whole digital Pakistan is a fantastic idea. And if you could actually take forward the better business regulation reforms, work with provinces and the federal government to have similar standards, agile regulations, then you'll essentially see a lot more coming out in terms of businesses formalizing, etc. Because as you know, 90% of Pakistan businesses are micro enterprises, less than 10 people. And then you've got the large corporates who are essentially shielded from competition. So we also suggest that this is a good time to provide smart policies to essentially instill more competition. As Pakistani businesses invest, you'll also get a lot more investment going. So just to summarize, we see a significant contraction in this fiscal year, a slow recovery in the next fiscal year, and reforms that the country could do to get to bounce back better. And I like to conclude by saying there's a tendency for the whole world to essentially expand the public sector footprint, because everybody is asking more things from the public sector. So one plea would be not to build permanent structures to deal with a temporary crisis. And this so that the country can avoid a public sector overhang when the crisis abates. So thanks for listening. I'm happy to provide any clarifications. Over to you.
There were two questions. One was about this possibility of debt rescheduling or debt relief from G20 and Paris Club. Not only government of Pakistan, but many other countries now they are asking for it. And listening from Shabi, of course, the Pakistan's economic growth in the current fiscal year and then next fiscal year doesn't seem to be quite impressive. So do you see any possibility of it? And second was sort of World Bank and ADB's engagement with the countries. Looking at the track record, most of the time it was in the mega infrastructure development project, but this COVID, that has informed us that it is about social sector development, and social sectors like health, those can't be left to private sector alone, whether in United States or in Pakistan. It's a public sector, public healthcare system which has to come to the rescue of the people. So do you see that post-COVID there would be added investment in social sector by the World Bank?
Okay. So thank you, Vishal. So yes, the economy can recover faster. So the question that all economists and practitioners, everybody is debating is whether there'll be essentially a L-shaped, U-shaped recovery or a V-shaped recovery. So essentially the speed of the recovery will be determined by how fast your production lines come back on. So essentially what we're saying is that, you know, there are structural reforms which I had highlighted earlier. The faster those can be done, the better will be the pace of the rebound. Definitely there are scenarios where the economy can actually sort of respond faster. One question you raised was about spending more. I also think there are real opportunities of spending better. When you look at the PSDP and when you look at the recurrent side of the budget, Pakistan does it separately. So you'll have a lot of investment sometime in healthcare facilities, but not enough in operating costs, etc. You also see a perpetual underspending in the PSDP itself. So there are systemic issues where I think the country can actually spend better. E-procurement, you can also do framework contracts. There are many ways in which you can actually get value for money from the amount that the country is spending. We've done detailed assessments and reviews. We'll be happy to share with you in this regard. Let me ask Gonzalo to please come in on some of this response times that he's done through these rapid surveys in terms of getting back on, and maybe also Gonzalo can come in and see what he sees as global trends on trade and how the elasticities, etc., have been calculated for us to suggest what our response or bounce back could look like. So Gonzalo, if you could come in for 2 minutes, it'll be very helpful.
Melinda or Illango, do you want to touch upon this question of debt rescheduling and debt relief?
I think you'd also asked us about the portion of the support that goes into the health sector. And here, Shabi made the point I was also going to make, that really what we've been working on over the last few years and are working on going forward is also on the quality of the health expenditures. But that being said, it's always been around 15% of our support directly into these sectors. And of course, like all of the development partners, we've taken a hard look, as Illango said, at the pipeline and the portfolio to try to redirect the funds more in these sectors, and also to make sure that they're able to be executed quickly, because that's the really important piece. On the debt relief, there's an ongoing discussion about this. I know that the president of the World Bank is also speaking with the other IFIs. There was a statement made to the G20 about looking at bilateral debt relief. And so I think that's an ongoing conversation.
So one big area that if you, for example, go and ask for debt relief, your creditors will ask you what you are doing to essentially not put that money down, right? So one of the questions is the country spending on its SOEs crowding out the private sector? And if you were to give debt relief to the same kind of a fiscal system, would that benefit the people? That's a question that I love to ask you, what you think as a think tank. But many people say the following: you have private sector that is struggling as much as the public sector, yet you are re-subsidizing loss-making SOEs, which are actually then competing with the private sector. So there are lots of internal competition in the economy, which is bringing you to a race to the bottom, because you give subsidies to SOEs, they then compete out at a huge loss private entities that essentially could go global. So I look at, before working on the Pakistan program, I used to be the program lead on Southeast Asia. AirAsia, which was a small airline that started off with single country operation in a country with like 27-30 million people, and it's now a regional player. While you have a market of 200 million people who are not particularly getting out of it. So the question is, what kind of a new social contract would there be between both the functions of the state, the private coming in, and then going to the creditors and saying, this is a new way we're going to do it. Are you willing to put your taxpayers' foregone money into this? Love to have a conversation with you on this, G.
Okay, I just want to make one observation. You asked about sort of, are we shifting our priorities towards more on the human capital? So let me just make two quick points. If you recall, in our Pakistan 100, we said for Pakistan to become upper middle income country by 2047, we clearly indicated that investing in human capital and human capital accumulation are very critical. So that's the direction in which we are heading. And we take you from the government. So if you take historical health sector spending has been around 0.8% of the GDP, whereas the government subsidies for SOEs are 1.5% of GDP. So you clearly see where the wrong shifts have happened, where the wrong direction has happened in the past. So these shifts need to happen. And then if you look at the per capita health spending, Pakistan does about $42. Take my country, Sri Lanka, which spends around $110. And even in the $42, only 1/3 comes from the state. The balance is out-of-pocket spending. So clearly, Pakistan needs to look at putting more money towards human capital, health and education. Right now, together, it's around 3% of GDP. It at least needs to double for the size of its population and for the ambition it has. Third, when coming to our program, this year alone, if you look at our entire financing, will be around this fiscal year, that is ending June 30th, will be around $2.6 billion, of which about 1.135 billion is going to go for human capital related investments and policy support. So let me stop there.
Thank you very much, Illango. Very convincing figures, and of course, that reminds us that we as think tank perhaps has to do a lot of evidence-based lobby with the government as well, so that their focus can be brought back to social sector development, to health, to education, and to PSGP. Now I'll open the floor to take some questions. I think maybe 3 or 4 questions in one round. You can direct whether you like to ask this question to Illango, to Melinda, to Shabi, or to Alia Khan. If you can, those of you who would like to ask questions, if you can unmute your mic, I would have an idea who wants to ask question, or you can also post your question on our chat box.
Thank you, colleagues from the World Bank, for joining us today. Illango, you mentioned the 4 Rs. You talked about resilience, and resilience is something that we really need to look. We won't achieve resilience within a matter of weeks or months. I mean, it's definitely going to take years. The other 3 Rs, perhaps we can do that, but resilience requires a concerted effort towards addressing human capital and accumulation, environment and sustainability. These are some of the key outputs that came out of the World Bank at 100 report. It also talked about water, and there's another World Bank report highlights that 40% of our children are stunted here in Pakistan. There is recent research that we've highlighted in one of our policy briefs last week as well, whereby there is a risk of oral fecal contamination of COVID-19. There is preliminary research in China that points to it, preliminary research in the US perhaps that points to it as well, but we need to do more. Whether that pans out or not is still a question mark, and I think we need to invest in that. But the point remains that water and sanitation and hygiene are key issues when it comes to health and economy. There is a great amount of disease burden that prevails already in the country because of lack of clean drinking water. We don't have any sewage plants. So when we move forward in this regard, how can the World Bank assist think tanks like SDPI in ensuring that the research that we're doing, the work that we're doing with the universities, find some traction, not only within the government, but also amongst institutions such as yours? Thank you very much.
Yeah, Shujat and then Sajid Amin.
While looking at the developing countries who are mostly dependent on aid or debt from multiple donors, multiple number of countries from where, like in case of Pakistan, from countries where it was borrowing, those countries are now shifting their focus towards social safety net programs. And in Pakistan, that money was also being spent in the social safety net programs and other economic activities. Now, what will be the future for those countries from where the money was coming in, and what will be the future of program, and how World Bank is looking into this area?
Thank you, Shujat. Sajid Amin.
Sir, thank you. Thank you from the team from the World Bank for an excellent discussion and feedback. My point is regarding the impact of COVID-related lockdowns on SMEs. We still are lacking any data coming from Pakistan, but if evidence from China, Italy, or anywhere else is a sort of the guide, it's saying that the more than 40 to 60% SMEs may face a cut of 50% income in the face of 1 month lockdown. Another 40-60% may not be able to survive beyond 1 month based on the cash flows. How is World Bank looking into it? I mean, are there any assessments in consideration on this one? Particularly when we see SMEs in Pakistan are already facing very poor state of situation. I mean, slowing down economy, higher costs of production, higher interest rates, and a very low share in credit to private sector. You know, SMEs in Pakistan has only 7% share to SMEs goes to how you see the impact will be coming on SMEs, and what can be the options or the strategies that should be taken to avoid these massive layoffs which we can expect if SME sector is not timely helped actually. Thank you.
Last question of this round from Vakar.
Thank you, Dr. Suleri. Thank you to the World Bank team for taking out time. So I just have maybe three main points to make, and these are sort of comments, and anybody from our colleagues from the World Bank may like to respond. One, of course, is around the development partners coordination. Somehow one has this feeling that during the 2005 earthquake, during the 2010 floods, for example, the kind of effort that was coordinated at a national level in the spirit of cooperative federalism, somehow that is lacking, and we are hearing these views from the smaller provinces, particularly government of Balochistan or even Sindh day before yesterday made a point that a CCI meeting should have been called and National Economic Council should be meeting more frequently so that a more coordinated request to the donors can be made. So that's one comment. I'll love to have some response on this. The other is that on the SMEs, of course, there are two very comprehensive programs that World Bank is currently managing. One is Pakistan Raises Revenue, and the other is Pakistan Goes Global. And one would really like to know that in the face of COVID, how does World Bank's own programming in any manner change? Because both these programs are going to impact SMEs, exporting sectors, non-traditional sectors, potential exporters, and so on. My final point is on the very interesting remark that Shabi and Illango made around the way we have been subsidizing our SOEs, and certainly it has distortions that get created on both the production side and of course in later rounds consumption effects are also there. So one of the recommendations which SDPI has been making recently, and would again love to have your comment on this, is that Pakistan should now see this as an opportunity to promote social entrepreneurship in these times. And it is only post-COVID that we have seen some very good social enterprises in Pakistan come forward on the back of charities, philanthropy. But we believe that they can now be encouraged as a sector through, of course, preferred public procurement, as well as making them partners in SRs. So the resources are there. Instead of just sort of diverting them towards the traditional vehicles, which is the SOEs, why not take it as an opportunity to promote social enterprise and third sector in Pakistan? Thank you.
Thank you, Vakar. Quite interesting questions. Illango, if I may request you to take a lead, and then you can direct your relevant colleagues to respond, whoever you would like to. And for a moment, if I also request you to switch on your cameras while you speak, so that our social media team, they can capture your picture for the tweet after the seminar. Thank you.
Okay, so let me take the question that Imran posed around donor financing and what happens if they are going to spend more in their own countries for safety nets. So let me sort of be a little philosophical here by saying that first, I see every crisis presenting an opportunity. And this perhaps is an opportunity where Pakistan needs to look at taking forward its own domestic revenue mobilization and relying less on donor financing. And if you look at the tax to GDP, it's around 13%, which is far less than the 15% which we think the state should have to be able to run its affairs properly. And over the years, if you look at all the tax exemptions that have been granted, the way GST currently is being implemented, it requires harmonization. That's a structural reform that we have been advocating. Second is look at the agriculture income tax, which is non-existent for a country which has 1/5 of its economy is out of agriculture. 43% of its labor force is employed there, but no agriculture income tax is paid. Third, take the case of urban immovable property tax, which hasn't been revised for a long time. So why not Pakistan really look at using this crisis to go through some of the structural reforms needed in the domestic revenue mobilization and be able to kind of raise the revenues needed, which also will help you to then increase your spending in the social sectors as we previously discussed. And therefore you can join other countries in Southeast Asia and elsewhere that over a period of time who started seeing a decline in donor financing, but continue to be able to raise their revenues and then also go to the capital markets. Yes, institutions like the World Bank and ADB, we continue to provide necessary concessional financing or more attractive market financing to middle-income countries that will continue to support what you think are priority cutting-edge investments, whether in the areas of human capital development, R&D, or in some real high-end infrastructure that you can't otherwise finance on your own. World Bank can come and do it. So that's the kind of blueprint I would offer as an answer to the question around what happens if the donor financing dries up. Pakistan has been seeing a steady decline in bilateral donor support, whereas the multilaterals have remained where they are, they have increased. And you are going to see that continuing to happen. On the question of engaging think tanks, I very much agree that think tanks need to be part of any solution. You bring great ideas. It's up to us and other institutions to continue to draw on your inputs as we did through Pakistan at 100. We crowdsourced a lot of ideas from think tanks. We continue to reach out to you, and my colleagues can then talk about in specific areas how we have sought input from various think tanks. On donor coordination, yes, it's a very good point. Certainly, there is no national mechanism that exists today that brings together government and development partners. Efforts have been made, but they haven't really materialized. Again, if you look at the donor or the development partner landscape, you're increasingly seeing it's largely multilateral, and perhaps UN and European Union and UK DFID, and then China is another big part of it. All the others follow in much smaller numbers. So, and then you take the 18th Amendment and federal and provinces, you really don't have an architecture. But I can tell you that at least since the outbreak of COVID, we donors have been coordinating among ourselves. Every week we have what's called a weekly Tuesday dialogue among development partners, where we share our views and we kind of exchange information and also talk about what we need to do collectively. And the Planning Commission has this subcommittee on socioeconomic disruption response. And the UN has been helping them with doing the impact assessment. They've reached us for some support on preparing an action planning framework. So we are coordinated on that. When it comes to the provinces, what we have done, Melinda can add to this. We have bilaterally had conversations with all the 4 provinces. In the one with Balochistan, EU joined us, and in the one with Punjab and KP, DFID joined us. So wherever donors have predominance of presence in a province, we are trying to come together with them. So these conversations will continue to happen. And last week, or earlier this week, Punjab presented its own response plan, which is a very good first effort on their part. And so now we are looking at how we donors can look at how to support that plan, and that was presented to all the development partners. On the question around SMEs, let me turn to Shabi and Gonzalo, and they can also address a question on what we are planning to do on micro enterprises and social entrepreneurship. So one point on SMEs, I very much agree. It's 90% of the employment or with micro enterprises in the informal sector. More needs to be done. And this is where think tanks can help. Sometimes what happens is the big businesses, because they're the elite, they can band together and demand more concessions. But there is really no voice for the micro and small and medium enterprises. And this is what something, there's a lacuna in the public policy space that we need to find. We need to all voice and advocate for them as well, so that they become a vibrant part, as we've seen in many, many countries. So over to you, Shabi and Gonzalo.
Thank you very much, Illango. So I think the question of SME, one is about related to finance. So there's a lot of debate about the interest rates, right? Whether or not the policy rate is too high. What we see is when the policy rate was much lower, it wasn't as though SMEs were actually getting more credit. And this goes very frontally to the fact that you have very few banks that are actually lending to SMEs. Those that are lending at much rates than that. And the other issue is, if you were an SME, why would you formalize? The moment you formalize, you have like 16 different regulatory agencies show up demanding you to comply to regulations from the 1980s. The question is, why would you do it? So, Waqar Sahab, your question is, at this point in time, it will probably be best to tide over SMEs through whatever support that can be provided, so that they come out of this not with too much loans. Because if you straddle them with more loans at this time, their overhang will be much higher, and actually when they need to ramp up, they might just die, as we are seeing in other parts of the world, including Turkey. We're following Turkey very closely on what they're doing on such support. They're trying to develop programs to tide them over with various sort of grants, etc., that could be so that's one point. And the other point I just like to re-emphasize is the Growth Commission, which looked at the single generation success story, never had the type of public sector footprint that Pakistan had. And actually, those countries that did would have got much further if their footprint was lower. This is a good time to really have an thought whether or not you want to keep SOEs that have been making losses for all the reasons that are known, to be doing that when the economy comes out, and keep the economy constrained in this regard. You have private sector which is much more nimbler at making the value chain connections with SMEs than any public sector would do, and the thing about public sector. So I do think that we should work together to also think through what the public sector footprint should be, and how can one sort of get to that stage where there isn't a crowding out of the private sector. That is much more when the economy comes out. So I'll now go to.
So on Waqar's question on how can we support SMEs and linking it to the Pakistan Goes Global agenda, I think there are three ways in which SMEs can be supported at this stage, and at the same time contributing to contain the spread, right? So we're looking into supporting the government in reducing tariffs for COVID essential items. And just giving you an example, N95 masks that are crucial, they require this nanofiber that is melt blown. So melt blown fiber has a 12% import duty. So the agenda of reducing import duties at this juncture is crucial to help firms repurpose their production into COVID essential items. It is also crucial from a humanitarian point of view when it comes to food products, and when it comes to ventilators, when it comes to protective gear, etc. So that is one area in which we're working together with government to support the government, but also firms that want to get into producing this type of materials. The other area is grants, direct grants, matching grants to firms, so that they can repurpose production. And here I would like to draw to a study that IBA just put together in Business Review today, in which they claim, industrial mobilization is crucial, and there are many SMEs in Pakistan that could have the capabilities to be producing protective wear, particularly textile and garment plants, pharmaceutical plants that could be producing hand sanitizers, and light engineering industries that could be producing simple ventilators. So for this, firms will need support to incorporate the technology they need, and so matching grants can be provided in this area. And then moving forward to the recovery phase, as I mentioned before, the crucial thing is export promotion. I think so. What SMEs now need is an injection of liquidity so that they can protect their productive assets, and some of them may be able to actually contribute directly through repurposing production into COVID essential items. So I think there is where the support to firms needs to be focusing on, and that is the way we are thinking Pakistan Goes Global could contribute. Over.
Thank you, colleagues. Now we come to the second round of questions. Yes, Zahra, first you, and then we have Ahad Nazir.
Yes, hi, hello. As we know that there will be a lot of problems regarding, mental health. So how could we see like the equal access and the gender inclusion in terms of like to overcome ethnic, religious, social, economic, and cultural challenges, both at the policy and the field level? So how could we see the role of gender equality and the equity, you can say, in terms of social inclusion? Like how could we be responsible to lead the strategic planning and technical guidance to mainstream gender equality and like social inclusion standards? So my question is how we will tackle like gender equality and equity in terms of social inclusion. How could we see the role of role and ensure fairness?
Thank you, Waqar Shirazi.
Many thanks indeed, Abid Slari Saab. My question would not be directly linked to the topic, but it is a serious question to me. And the question is from Illango, that if Illango is hearing me. As you know that the social safety net in Pakistan, including BISP, the Ministry of Ehsas, do have a repository or registry of the people for assistance in such pandemic or in such emergency situations. But it is a fact that there is a certain inclusion and exclusion errors in the repositories, and all the population could not be covered through the social safety nets because of this exclusion error specifically. In a particular situation of corona pandemic in Pakistan, the vacuum which has been created because of the few previous decisions of government of Pakistan on sanctioning or banning few of the international development sector organizations or international NGOs to work in Pakistan, a vacuum has clearly been observed. So SDPI being a think tank and the World Bank being an important partner or donor of government of Pakistan, do you have any plans to suggest the government of Pakistan that these sanctions should be removed so that these kind of catastrophes or the pandemics can be handled efficiently and the people can be reached out more effectively, so that those who have very less resilient in absorbing the shock of these kind of economic situations may be supported more effectively, please.
Well, thank you, Waqar. Ahad?
Thank you, sir. So I'll just like to know that what do we have any status regarding the condition monitoring with regards to the COVID preparedness? Like how many national laboratories are there that we can use for testing? Similarly, how many facilities are there that can be used? And my second part of the question will be, anyone of my colleagues from the World Bank can answer, is that especially with regards to the energy sector, there were some initiatives that were focused on climate that were being aligned with the climate change initiatives. And I've heard from some friends in China that they are also going back to coal and other fossil technologies. So do you feel that a similar effect can be seen in Pakistan as well? Thank you.
Thank you. Back to World Bank colleagues.
Thanks, Abid. Thanks, colleagues, for these questions/observations. I will respond to some, and then I'll ask my other colleagues to come in on some details. So the first question on gender inclusion and so on, absolutely, this is important. And what social distancing tells us is, age-old behaviors can be broken in the interests of human welfare, and we are seeing this happening. Wherever COVID-19 the curve is flattening, it's where social distancing has happened. So obviously, any response strategy has to consider the dynamics of inclusion, and we very much look at gender aspects very closely in the design of our programs, and as well as in advocating for better policies, especially in the area of women economic empowerment. On safety nets, yes, the NSER, the National Socioeconomic Registry, is being updated at this point, and I understand SDPI is also part of the updating process. About 35% of the update is complete, and part of so the NSER is being used for the top up for the beneficiaries, but at the same time they're also using SMS surveys and big data to also reach other beneficiaries. Certainly, an updated NSER would have really resolved this issue of inclusion exclusion, but we have to find other means through which to ensure that the exclusion doesn't happen, as well as double dipping doesn't happen. This is why an NSER with the shared data sharing protocols, as well as with the unified governance arrangements post updating, would help Pakistan to have a single mechanism for targeting the poor and vulnerable, so that federal and provinces could all undertake their own cash transfer program, conditional or unconditional, on a single targeting framework. On the monitoring and evaluation, Melinda, do you would like to come in on this particular part and how we are doing our monitoring and evaluation?
Thanks, Illango. I've unmuted. I've been having some trouble with my bandwidth. I'll try the webcam again. So the monitoring and evaluation, is part of all of the interventions and the projects we do, and has also formed an important part of the technical assistance work which we do with various governments, and particularly at the provincial level, where most of the delivery of services rests with the provinces. So this has been part of the dialogue and I know SDPI has as well, as we look at the portfolio, how we redirect the portfolio, and also work on the pipeline. Here, a related comment I think it's worth making, and an observation. So, we're into sort of the third or fourth week of really the crisis being here in Pakistan. And in the first couple of weeks, there was a lot of energy at all government levels, both towards moving to address the immediate crisis, and also to put in place the systems that will make it possible to track and monitor how the funds are being used. Now, originally, the use of funds was in a way simple, because it was very, very clear what the urgent and emergency needs are. Now, as we move into this next phase, working on the types of things that several of the commentators and Shabi and Gonzalo were talking about, this goes back to being a little bit more complicated again. And I think when we were talking about ways that this crisis could be an opportunity to move forward on things like SOEs, I think the same is true for how the government as a whole is functioning. And you see this energy and a lot of things become unblocked. And then already, I think we're beginning to see the same sorts of things that cause people to be concerned to take decisions, because they will be monitored both for good and in the public as well, re-emerging. So I think this is a risk we see going forward, and why we do want to help the governments, the various governments, put in place good monitoring and evaluation systems. Over to you, Illango.
Thanks, Melinda. Thanks. So coming back, I think I missed this question on NGO. I mean, there's the NGOs, international and national, as service providers. So my understanding is, I haven't seen the notification, but I understand EAD has exempted the NOCs, especially to those who are providing services and operational support for COVID response. So this is what we were advised. So if I get hold of the notification, I'll share it with you all. Then on the energy sector, about going back to the non-renewable, I haven't heard about China taking a step back, but let's look at Pakistan. Government has approved a policy that by 2030 they would like hydel, wind and solar to be 70% of the energy mix. If you take today's energy mix, 4% is solar and wind, you have hydro about 30%. So you're essentially wanting to double that over the next 10 years. And this has multiple advantages besides the climate benefits. The other big one is the reliance on imported fuel will come down. And this should help a lot in resolving some of the circular debt issues. Obviously, with the economy contracting now, the demand for energy, for electricity has dropped. So you would see a temporary spike in circular debt because some of the capacity payments and fuel adjustment charges are fixed costs in a take-or-pay contract, so they will need to be honored. So you would see that happening. Eventually, the best way for the country to resolve the crippling situation with the whether you have had blackouts or continuous build-up of circular debts every few years is to work towards resolving once and for all the generation cost, which is among the highest, 25% higher than other regional peers. This needs to come down. The only way this can be done is through a combination of hydro, wind, and solar, and continue to and reduce your reliance on imported fuel, including coal as well. And so the 70-30 mix for 2030 is possible, but it would require big investments both in the public and private sectors, as well as building the transmission capacity. But more importantly, Pakistan also needs to resolve this question around the inefficient distribution system, which has large losses and thefts, plus the continuing poor performance of discos that are running large losses. I think we responded to the second round of questions, Abid.
Avisa, can I come in on one question that was raised on the laboratory network?
Yes, please. Yes, please.
Yeah. So currently there are 25 laboratories working across Pakistan that have the capacity for running coronavirus 19 diagnostic test, which is real-time PCR. And I would encourage you all to take a look at the Ministry of National Health Services Regulation Coordination's website, which is nhssrc.gov.pk, which gives daily updates and weekly updates on what the situation in the country is and what the government's response is. Currently, the capacity of these 25 laboratories is to conduct about 6,500 tests per day, but the ministry has passed on a notification that they're going to strengthen these laboratories and make sure that the daily testing capacity against corona should go up to 20,000. I hope that answers the question. Thank you.
Thank you. Dr. Hina Aslam, you wanted to raise some point?
Thank you, Dr. Abid, and thank you, Illango, and my colleagues from the World Bank. This is again following, the question of Ahad, my colleague from SDPI, and the recent response from Illango on the energy sector of Pakistan, and also very motivated to see that the World Bank is, quite keen to towards making this renewable energy boosting up and financing additional 700 million of the funds to support the hydropower project in terms of talking about the clean energy. I just wanted to know that since in the face of this COVID-19, there have been studies and surveys happening to take actions in these sectors, in the other economic sectors of Pakistan. Has there been any prediction or any impact study that could tell us about the predicted impacts and what could be done for the post-COVID scenario done by the World Bank colleagues or somewhere that you know of? Thank you.
Thank you, Ina and Illango. If I can add a couple of observations. Now the World Bank's flagship work, Pakistan at 100. Have you got any plans to update it post-COVID? Of course, some of the scenarios and some of the pathways that you had proposed in that work, that would remain same, the structural reforms and many others. But do you see any need to update it once the COVID is over? The second is only last night, the Speaker of National Assembly, he said that the budget for the next fiscal year would be presented in June 2020. Do you see World Bank helping government of Pakistan in devising some sort of budget strategy paper or some of the budget targets? And finally, yesterday we had Fawad Chaudhry with us, the Minister for Science and Technology, who told us that in the public sector laboratories, they have the capability and capacity to produce ventilators and to produce other equipments. But he said that it's about the financing, either public-private partnership, so that those can be produced at a commercial scale, ventilators and testing kits. And I was thinking now, talking to you, that can some of the money that World Bank has reallocated be channeled towards Ministry of Science and Technology if they have this indigenous capacity to produce those equipments?
Thanks, Abid, for the follow-on questions. So let me ask Shabbi to come in on the impacts to the real sector. We've done some work around on agriculture, livestock, manufacturing, and services, so he can talk about what would be the COVID impacts, and then I can come to the others. Over to you, Shabbi.
Thank you very much. So what we see is that the major impact will be in the services sector as well as manufacturing. I think agriculture, we know, is a little bit sort of immune in certain ways because production will happen. The issue will be about getting farm to table sort of like logistics going. And then, of course, as Gonzalo had said, over time, to go into more value-added services. So the question, agriculture. So the question also goes back to the Pakistan at 100 theme of doing more with less. And that goes to the issues of water management and the like. Now, you also raised this point about Pakistan at 100 and what happens next. So the way we see it is that structural issues are pretty much the same. There's a blip that will essentially get you into a contraction, but then there are so many opportunities to essentially go for implementation of the reforms already identified to get you to that 7% growth trajectory. So I'll stop there and ask Gonzalo to come in on any points related to this.
I don't know, Gonzalo, are you still connected or not? If you're connected, please also address a question around the last point Abid made around the Minister Fawad Chaudhry asking for more funding or public-private partnership to build indigenous technology based on the work done by Pakistan laboratories. Are you there, Gonzalo?
So until Gonzalo comes in, let me Gonzalo, you there now? Okay, so let me say with regards to the digital part, we actually think public-private partnerships should be those that bring in the private sector rather than those which sort of bring in the private sector while the public sector takes all the risks, gives away all the sort of concessions. So I actually think that the tech industry is really vibrant and they can be totally part of the solution, without the public sector sort of like, giving any money away, they can actually bring in the private sector to build all the things that are being talked about, simply by being smarter about regulations. And this is again about lowering the public sector footprint. Dr. Wakar mentioned how social enterprises are thriving. And one of the reasons they are thriving is because they're not regulated as heavily as other parts of the economy. So again, I would say you can do a lot more by being a lot less.
Thanks, Shabi. Abid, on the question, I very much agree that there is indigenous technology. Yes, so if that's the case, this is an opportunity for Pakistan to actually strengthen the intellectual property rights, and if with that kind of indigenous technology, and how do you essentially then sell it to the private sector or get the private sector to be the ones making it, rather than trying to create other SOEs that will then, after about a couple of years, when they're finished doing making the kind of medical and equipment supplies needed for COVID, then you'll have to start looking at what other business they can do. It's better that this indigenous technology and research is turned into an intellectual property, and then that intellectual property has a value to itself, where the private sector will be able to acquire it and then be able to do it at a mass scale, which then the consumers and the public at large will benefit. So that would be my thinking around how to support, and we're certainly interested in working with Science and Technology Ministry to make the intellectual property area much stronger in Pakistan. On Pakistan at 100, we haven't thought about any updating, but again, as I said at the beginning, it's a question of whether you use this crisis to turn it into a big opportunity. So some of the structural reforms that otherwise have been deferred from SOEs to energy sector, if they all happen at a faster pace, then you are really looking at the pathways remaining towards a more optimistic one. But if everyone feels this is a difficult time to do any serious structural reforms, and then if your recovery is going to be weak and slow, then the second pathway is the one that would kind of be confronted with in the immediate 2 to 3 years. So anyway, that's a good suggestion. Our team will take a look at it and see if any updating is done, how we're going to look at the scenarios. On the budget, we've been sharing ideas on the impacts of COVID on the socioeconomic aspects. As I said, our focus is over the next 15 months is going to be a lot on the COVID response, whether it be on the health and medical emergencies or dealing with the socioeconomic disruption. And we will certainly support them towards on the stronger recovery path and on a quicker footing. So certainly next budget would need to be looking at more in terms of breaking out from the past and using COVID as a means. One, yes, certainly one has to be compassionate and provide the safety net support. But on the second hand, you need to be aspirational and use the budget in a way to break out of what has been the past policy failures.
Yes, thank you very much, Illango and the World Bank colleagues for this very candid discussion. It was extremely educating, learning opportunity for us. My takeaway from this discussion is that I think it is about time this pandemic challenge, and because it's challenging all the world, including our development partners as well. Perhaps this is a time where Pakistan can get out of this dependency syndrome, looking at what we possess, looking at the new ways of doing things, and bringing some of the much needed reforms whenever times allows us when this pandemic start phasing out. I think that is the path for quickest recovery. In the meantime, we appreciate the support from partners like World Bank and ADB and IMF and many other bilateral partners who are supporting and helping the government of Pakistan's response to people of Pakistan. Thank you very much. And SDPI, as it was said in the beginning, and that we as one of the independent policy think tank will be more than happy to act as a bridge between you and the government wherever it is required, or if you require any sort of monitoring and evaluation of the responses, any sort of the condition from the on the ground realities, our team would be very much at your disposal.